A pricing policy for pharmaceutical products is being worked on by the Ministry of Health and the pharmaceutical industry in Ghana.
The program officer of the Ghana National Drugs Program, Brian Asari, says the policy will help regulate prices of pharmaceuticals, thereby making them affordable.
Brian Asari explains the rationale behind the policy.
The ministry and government in general has made some interventions in this area, and by that we mean that first of all, we have a pricing policy underway. Government is working seriously on a pricing policy which would seem to try and contain the price increase and make sure that the person who pays for medicines out of pocket would have some buffer. At the same time, our health insurance would also have a lot of savings and then improve, become more sustainable.
In a stakeholders meeting in Accra, the pharmaceutical industry called on the government to consider exempting the industry from VAT on major inputs of production. The director of the pharmaceutical services at the Ministry of Health, Martha Gansa-Letrot, says there should be a level playing ground for both local and foreign companies in the pharmaceutical industry.
If the local manufacturers are not giving certain incentives, then the importers must also not be given certain incentives. So I think, to be fair, that is why we are having this in a very transparent manner and in an accountable way, to ensure that everybody knows what is going on. I think it will not be fair that local manufacturers are not enjoying certain benefits and the importers will be enjoying that benefit.
With government assuring of giving contracts to the local pharmaceutical companies to produce some of the country's pharmaceutical needs, it is expected that this new pricing policy, when implemented, will be an added incentive to local manufacturers.